Troubling new data by the CDC is shedding new light on why the nation's top health agency reversed mask recommendations on Tuesday for the vaccinated. And it's adding new concerns about the highly contagious Delta variant. First, the CDC has learned that the Delta variant is more transmissible than the viruses that cause MERS, SARS, Ebola, the common cold, the seasonal flu, and smallpox, and is just as contagious as chickenpox. A CDC study also found that although a vaccination makes it less likely that you'll catch COVID-19, if you get it, you are just as contagious as those who are not vaccinated. And that's why the CDC told those who have been vaccinated and live in COVID hotspots to go back to wearing masks indoors. All that as 49 states are seeing a spike in cases, and some experts say restrictor vaccine mandates may be the best way to prevent a full downward spiral. And some Texas hospitals may be headed towards a crash course as facilities are reportedly being pushed to capacity at a time when staffing is short and workers are exhausted. But don't tell that to Texas Governor Greg Abbott, who just signed an executive order prohibiting mask mandates or vaccine requirements for government agents and municipalities statewide, and he's threatening to fine local officials who enforce new mask mandates. Joining me now to discuss is pulmonary and critical care doctor at Cambridge Health Alliance and Boston Medical Center and an instructor of medicine at Harvard Medical School, Dr. Lakshman Swamy. I almost changed your school there, Dr. Swamy. So, Greg Abbott is not the only governor who is going after the idea of having mask mandates either in school or in the office or in government buildings. What do you think about this politicizing of this new surge?
Thanks for having me. You know, I think it's unfortunately nothing new. We've seen politicization of all of masks and of vaccination over and over again for the past year and a half plus now. I think the key thing to keep in mind here is that masks do work indoors pretty well. What works even better is vaccines. And when it comes to Delta, unfortunately, I think until we know more, until we have a better handle on things, masks and vaccines work awfully well.
Let's talk about what we know about, vaccines and the new Delta variant. What do we know about how frequent breakthrough infections happen? I think we were just, general public were under the impression that it was a random, weird, off-chance thing that might happen, but for the most part, if we got vaccinated, we were not going to get this virus.
It's a great question. I think it's what many of us are thinking about today. Here's what I would say. The vaccines still, from all the data we have, are still incredibly effective at protecting against all variants, including Delta. Now, the vaccines are scientific marvels, but they're not miracles. I think we in the medical community are not surprised that there's breakthrough cases. I think it's really disheartening, and unfortunately, just this virus, this pandemic, it's not over. That if you are infected, whether you're vaccinated or not, you're shedding that virus, and you can infect other people. That's pretty scary, I agree. But the vaccines still save lives, tremendous lives. The only people I'm seeing critically ill in the ICU right now are unvaccinated, and that's heartbreaking.
So even in the case of the Provincetown outbreak, and where all these breakthrough infections happened among the vaccinated, many of them showed absolutely no symptoms. How do you know? I mean, are we going to start seeing people say everybody should start getting tested again anyway, even if you're vaccinated, just so that you can know that if you're a carrier and therefore a threat to other people?
That's really on point. And I think the point here is that that's going to be true probably in some communities more than others. When you have a really high vaccinated rate, and I think Provincetown's probably a little different. It's a tourist hotspot. There's a lot of people visiting there. But I think when you're in a community that has really high vaccination rates, unfortunately, that's not a lot of communities, then I think you don't need to worry so much about asymptomatic carriers and all of that stuff. I think that stuff actually isn't that common. It's probably rare fair enough that when you have really high vaccination rates and without a lot of other people coming in that aren't vaccinated, you probably don't need to do all that. That said, I think masking indoors probably still helps because there's a lot of people who aren't vaccinated. I'm a parent of 3 young kids. If there's an indoor place where people aren't masking right now, I'm not going to take my kids there.
It seemed to me that the success of the first vaccine wave, when everybody, all the people who wanted to get vaccinated actually went out and got vaccinated, the success of that wave actually calcified the hesitancy because people started to believe, well, I've missed the wave, they'll get vaccinated, and therefore I won't get sick. And so the fact that the infection rate was so low, they could say, well, I'm not going to get it because I don't feel like I'm in that much danger. Do you believe, strangely, paradoxically, that the fact that this is now raging again will actually push up and help more people to cross over from hesitant to wanting to get a vaccine?
I really hope so. I think that what we are seeing and the story that's being told by my colleagues everywhere is the people that are getting sick and dying, it feels just like March of last year. And all those people aren't vaccinated. So I think there's a huge difference in how sick you get. I've talked to a lot of patients who are vaccine hesitant, and many of them they're just victims of misinformation. And they say things like, I just wanted to wait a little longer to make sure that it was safe because I'm hearing so many scary things about the vaccines. And that's misinformation because it's a question of how likely you are to get a problem from the vaccine, extremely unlikely, compared to now with Delta everywhere. I would say if you're not vaccinated, you will get COVID. At some point, you will get COVID if you're not vaccinated. So it's an unbelievable kind of benefit to risk ratio. The benefit is massive of getting vaccinated. The risk is incredibly low.
So, okay, let me shift gears a little bit and ask you if you can explain to our readers what is going on in the UK and India. They were having a massive problem with the Delta variant as well. And in the UK in particular, over the last week or two, it has just plummeted, the number of new cases. No matter what I read about it, I can't figure out, did they do something different? Did they have a mass rush on vaccinations? Or did something happen with the virus itself that caused the spread to stop?
I'd love to have a clean and simple answer for you. I think the truth is that every time people try to predict what coronavirus is going to do and how it's going to behave and where it's going to surge and not, it doesn't always follow the rules. That doesn't mean that the rules that we have of the things that we know are safe don't work incredibly well. I'm so happy to see cases falling. I'm still worried because I know a lot of people in India and it's not necessarily that good over there. I have family members that have died out there, and it's just nothing to be heartened by, I think, right now when it comes to Delta. I would be worried enough if I wasn't, if you're not vaccinated, you're not protected. If I wasn't vaccinated, I would be terrified.
So I took a flight today. Middle seats are filled all up again. Everybody's very close to you, and stewardesses bend down to ask you what you want, and they're right in your face. If this thing is surging again, are we going to go back to what we remember from 6 months ago, where none of that was the case? In fact, when you landed in New York, there were National Guardsmen there taking down your information and so they could track you. Are we going to return to that level of kind of safety and distance?
Let me put it this way. If we had really high vaccination rates across the country, it wouldn't really be a concern of mine that we would head back to anything like that. I don't know how else to say this, but I think we've given it quite a while of the honor code and people trying to do what's right and all that stuff. I don't think it's working. So I think that what we're seeing with many more employers mandating vaccination, many more healthcare workers requiring, COVID vaccination to go to work, I think that's so important because in the same way, I hope we don't have to go to those kind of draconian lockdowns again, but in the same way that when you use a heavy hand, it works. It's just that it's really heavy and it causes a lot of damage. In that same way, I think we have to really consider seriously that if we have to find ways to get shots into arms,
Well, Right. So Biden announced that the federal government was going to require masks and require vaccination, and if you didn't get vaccinated, you'd have to be tested. You know, that gave a little bit of an out. You could just say, I'm going to just go deal with the nuisance of getting tested all the time. But it has been the private sector that's been really leading the way. Is there something more that the government can do around mandates? I understand the politics around the word mandate when so many people are saying they want, their right to get sick. But is there more that the government can do around mandates that you think would be helpful?
On the one hand, there's this really tempting notion to kind of play the short game and just get the shots into arms, like I just said. What I really think is that we got to play the long game. Why are people not getting vaccinated? Don't have good relationships and access to primary care doctors. They don't have doctors that look like them. They don't have doctors that understand them. They don't have doctors that they trust. We need to build that infrastructure up so that people can go and call that doctor or NP or whoever it is and say, hey, should I get this? Because I think pretty much every time I've talked to a patient who's been vaccine hesitant, they've talked to everyone else and gone to every other resource, but they haven't gone to primary care. And I think that infrastructure, the threadbare infrastructure of primary care across this country, is why we see so much hesitancy, so many problems with this. And I think the government can play a role there.
Dr. Swamy, as we go through this wave, I hope that you will come back and talk to us about it, because I just think people need some information and some clarity, I believe, around what is happening with this new surge. Anyway, thank you so much for your time. I really appreciate it. America's fighting another pandemic, an internal pandemic. Ahead on Prime, while our next guest says racism is the virus of the American dirt. You're watching DNC.